Hi, guys. I am Angie Rasmussen. Nice to see you today, although it's actually not nice to see anybody because every day is a new, fresh hellscape. I'm coming to you live today by myself again because Jessica, my co host, is off doing important Ebola stuff because epidemiologists like Jessica are actually needed at this phase of the outbreak response a lot more than virologists who work in the lab like me and can, tell you how to interpret a lot of data. We can do stuff in the lab, but I'm actually not the type of person who responds to an Ebola outbreak. And boy, am I glad that I'm not, because this Ebola outbreak is really, really bad. And the people who are suffering, I think, the most from it are the people who are trying to respond to this outbreak. As usual, I don't have very much good news in terms of what we know about the outbreak. It seems that we're at more than 1,000 cases, more than 250 deaths. These are all suspected, as I've talked about before. There are a lot of other diseases that look a lot like Ebola virus. One of the things that I've been talking about a lot with my colleagues actually does have to do with my area of expertise, which is pathogenesis, and how sick essentially this virus makes you. So it does look like this virus might be attenuated slightly, or at least people are developing less severe disease, less frequent hemorrhagic disease. I'm still, really holding my breath as far as saying that this virus is not as serious as good old-fashioned OG regular degular like Ebola virus, what everybody thinks of as Ebola. Everybody thinks that virus has a 90% mortality rate because that's what the case fatality rate was from the first outbreak when it emerged 50 years ago in the Democratic Republic of Congo in 1976 in Yambuku, when what was then Zaire. That was the Democratic Republic of Congo's first Ebola virus outbreak. Now they're on their 17th, unfortunately. So they actually have quite a lot of experience with Ebola, and some of these epidemics have been extremely large. Now, the West African epidemic, which occurred primarily in Guinea, Sierra Leone, and Liberia, although it spread out to some other countries as well, those were the three that were primarily affected. It's a long way from DRC. But in that outbreak, we saw that the mortality was considerably lower, even though it's the same species of virus. And Ebola virus, good old-fashioned Ebola virus, has caused numerous outbreaks in DRC. And those outbreaks have also not had mortality rates of 90%. So I think that mortality is something that people talk about a lot. 90% sounds really, really severe, but actually, 50% is extremely severe. 1 out of every 2 people who get infected with the disease die from it. That's pretty severe. If you just look at the suspected cases and the suspected deaths, there's a very, very crude, and I know this is not the way that epidemiologists actually calculate this, but a very crude estimate of mortality is about 24%. In the previous outbreaks, Bundabugia virus has caused mortality rates kind of ranging between 30 to almost 50%. It doesn't seem like it's that much of a decrease from its known mortality rate. And I would say that 30%, the low end of that, is still exceptionally high. I mean, that is 1 out of 3 people who get this virus will die from it. Given the challenges and the complexity of the situation, again, this is basically a war zone. There are a number of displaced populations. It's a very diverse area. There are people of all different religions. There are people of all different backgrounds. It's a very large geographic area. It's about the size of Florida. So it is not a homogeneous population. It is not easy to actually conduct contact tracing and do the epidemiological work that will be needed to control this infection. And it's really not helpful when people are saying, oh, well, it's less serious than regular Ebola. This is an extremely serious situation. And even a lower mortality rate than conventional Ebola is still an unacceptably high mortality rate. Which brings us to the US government's latest decision. Boy, am I not loving this decision. The US government has decided that they are so afraid of Ebola patients and that Ebola is just absolutely not something that we want in the country at all, no more pandemic problems if we just don't let the Ebola people in the first place. And that includes American citizens who have been deployed to DRC and Uganda to aid and assist in Ebola response. This is something that the US used to be a world leader in. And during the 2014 to 2016 West African epidemic, we actually evacuated a number of people who were helping with the response at great cost to themselves. They got Ebola, brought them back to the US, saved their lives. For some people, that they were really, really sick and by all rights should have died, but they were saved because they were brought to a biocontainment unit, which is a specialized purpose-built facility within several hospitals and medical centers around the United States that have literally been built to deal with patients that are infected with highly pathogenic and potentially highly transmissible emerging viruses and other emerging pathogens. So if you get Ebola, you end up in one of these biocontainment units. And these are actually, I think, really responsible for the fact that we had multiple people treated for very serious Ebola virus disease. We saved all of their lives because the people treating them are actually experienced clinicians who have treated Ebola virus disease many times and are very experienced with it. So we have this expertise. We have these incredible facilities. Another important aspect of these facilities is that they are made so that there is no onward transmission to the community. There are no lab leaks occurring from these biocontainment units because they understand that one of the biggest risks is to healthcare providers. So they actually have staff and facilities that are trained to essentially make this a clinical care unit, but at the same time, make it like a containment laboratory, like what I would work in, where the entire facility is designed to prevent virus from getting out. And indeed, we had no local transmission of Ebola from any of these biocontainment units. The only transmission of Ebola that occurred in the US was in a hospital in Texas that did not have a biocontainment unit and did not realize that the patient who had come into the ER and was being treated by nurses there had Ebola. And so because this patient was not recognized as an Ebola patient until after those healthcare workers had been exposed, they got Ebola from him because that is a huge risk and a main driver of Ebola transmission. They, on the other hand, were sent to the biocontainment unit at the NIH Clinical Center, where they were actually cared for by Tony Fauci himself. And again, they recovered. So, we have this expertise, we have these facilities, we have a track record of never having an Ebola outbreak because we brought Ebola patients home to take care of them and give them the best possible care they could get. When they got Ebola, trying to prevent other people from getting Ebola, they were doing work, global health work that's incredibly important, incredibly risky to them, and is done by people who, in my opinion, are really just heroic people who are doing, something that they believe is part of their job and their obligation as physicians and clinicians, and people who want to help, because Ebola virus is a terrible, terrible disease, and they don't want people to be getting it. So what is the US government going to do this time around to thank those people who are putting their lives literally on the line to try to save people who get Ebola and try to stop an outbreak from spreading? Well, there's one American physician who has tested positive and his family is in quarantine. Another physician is in Czechia, also being isolated. And basically, that's because the White House said, we don't want you to come back to the US. You cannot get the best treatment in the world. Even though you are natural born American citizens, you can't come home because we don't want you here and we don't want your Ebola here. And I should add that these physicians who are, in Europe, because Europe would take them, Europe recognizes, Germany and the Czech Republic recognize that they need good care because Ebola is a really serious disease. And it's frankly pretty embarrassing that the US government is like, no, we're going to give it to our European colleagues because we don't want your gross Ebola. essentially. We don't want your politically inconvenient Ebola right in time for the World Cup. We want to let everybody know that the Make America Healthy Again plan of basically sticking your head in the sand and pretending that emerging viruses don't exist except for when they happen from lab leaks that Tony Fauci caused, that, there's no problems in the world. We don't even need to worry about a bunch of people, thousands of people dying horribly in Central Africa, even if some of them are Americans, because I don't know, healthy people don't get sick. That's not true. And these doctors were part of a medical missionary organization that was providing help because they're Christians and they, have a faith belief that it's important to do that it's important to provide medical care to people who need it, to provide humanitarian aid. I personally believe also, I am Catholic, I am Christian, but as an American, I believe that is one of our obligations to the world. If we want to be a world leader, we need to act like it. And we need to provide that not only for, people around the world, but especially for our own citizens. So what the US government has decided to do this time around, since I guess they can't send everybody to Germany and the Czech Republic, and they actually do need to save face because they just keep getting correctly criticized for withdrawing all of USAID's funding and withdrawing from the WHO and actually being $260 million in arrears to the WHO for unpaid dues from when we were still a member state. We're leaving bills all over town, which is, pretty standard for Donald Trump. We took all of our money away so that Donald Trump and his Office of Management Budget and Budget Director, Russell Vought, could, impound more money and take it for the executive branch. Basically, we're not going to do anything except imprison Americans in Kenya, where we are deploying public health service officers and undisclosed forces from the US military to build a new facility, I guess, with like the Kenyan Defense Forces. We do have military installations. We have military embedded in Kenya. They're one of our allies and our partners. So I guess this would happen on like a Kenyan military base or something. But we would build like a new Ebola treatment center, and we would basically force every American who had deployed to work, and respond to this terrible outbreak. We would thank them for their service by quarantining them forcibly in this facility for 21 days, I guess testing them all the time. And if they test positive, they will be kept there and treated there in this new facility. Now, as somebody who works in a containment laboratory, I don't treat patients. So I've never, spent any time in a biocontainment unit since I'm competent in the containment laboratory and I've never actually been infected with something that I'm working with. But if I were, and I'd be in a biocontainment unit, many of the same features of a biocontainment unit are the same features that go into building a containment laboratory that's used for research. This is not a facility that you just put up in a couple of days. These facilities are multi-million-dollar installations. They require building essentially from the ground up the containment capabilities. There's all kinds of things about air handling, about air disposal. In some places, they actually incinerate the air before it is exhausted. We use filtration and other mechanisms. There's a lot of different ways to actually do it. But you actually have to build some of these things in. For example, if you do a lot of animal work, if you do a lot of large animal work, like with livestock, you have to have what's called a tissue digester, which has to be built in so that you can actually dispose of those carcasses while you're in the containment environment. You have to have autoclaves everywhere so that nothing is ever getting out of containment unless it has been sterilized according to an exhaustively validated protocol. You have to actually train people to work in this environment. You have federal laws that are regulating this. For example, I have a security clearance that it took me 2 years to get because there is a lot of checking to make sure that people are going to be competent, to make sure that people are not going to present a security risk, and to make sure that the facility itself is suitable for carrying out this kind of containment work. So it's not as simple as like, let's just get some military people and let's just get some people from the public health service who know how to respond to disease outbreaks. And let's put up like a tent and we'll get them all some N95s and some Tyvek. And we're just going to like have an Ebola hospital. I mean, this is unbelievably crazy to me that we would be doing this at the very least, because it's a huge waste of taxpayer money. We have these biocontainment units that literally present less of a risk overall, less of a risk of Ebola transmission, less of a risk of the patient dying, less of a risk of an American being imprisoned in a foreign country by its own military and given substandard treatment for a disease like Ebola virus disease. It is unconscionable, and every single American should be very worried that our government is basically saying, ew, viruses, like, this is scary. This virus is very deadly. I think that we should just shit on the Constitution, like tear up the 14th Amendment and just like imprison people so that they don't cause political problems for us. And that is the rationale behind Kenyan Ebola prison that the US has proposed. Now, the US has been doing this, and I find it very ironic that Lockdown Jay Bhattacharya, the NIH director and the acting CDC director, spent his entire pandemic and 5 years since then, until he became the NIH director, complaining about lockdowns. Oh, lockdowns kill. Oh, school closures have damaged learning. Oh, all this stuff that didn't really happen during the pandemic that he claims was terrible because people just didn't like his dumb everybody go get COVID public health policy proposal. He's still butthurt over being criticized about his shitty serology study from early 2020. I digress, but I could talk all day about, Jay Bhattacharya's opposition to lockdowns and his complaints about all the people who censored him, even though he was literally complaining about it almost every day on Fox News and everything from Fox News to Steve Bannon's War Room. He's done the whole circuit saying that he's not political and he's very science driven and doing everything basically the opposite of what he says. So I guess I shouldn't be surprised that when hantavirus, Andes virus, broke out on this cruise ship, as myself and many other virologists said, this virus is not very transmissible from human to human, even by the airborne route, even though it can under some circumstances, like, say, a cruise ship, a floating tin can that is a demonstrably high risk environment for transmitting a whole bunch of different viruses. And Jay Bhattacharya signed an order that is going to force American cruise passengers who've been quarantining at the biocontainment unit in Nebraska. He's going to force them to stay there for 42 days. That's 6 weeks. It's like Jesus going out into the freaking desert and being tempted by Satan, except it's Omaha, Nebraska, and they've got nothing to do except to like post shit on Twitter and TikTok, I guess, all day. There's one guy who, is at least reporting back from Nebraskan quarantine. But, there's absolutely nothing to support like why these people need to be in this biocontainment unit in Nebraska when they could be quarantining at home. And in the past, that has been what we've done with Ebola. People who've come back from West Africa, for example, my friend Craig Spencer, who is an Ebola survivor, came back from West Africa, felt fine, continued to do, however, home symptom monitoring for 2 weeks, checking every day for a fever, checking every day for other symptoms of Ebola, which are very vague and mild at first, fever, headache, that kind of thing. Craig got a fever. He reported it. He went straight to the biocontainment unit at Bellevue. He was treated for his Ebola virus disease and he survived. He had very serious Ebola virus disease, but he survived. And he also did what he was supposed to do for home quarantine. Usually people are actually pretty amenable to doing this. But Jay Bhattacharya, Lockdown Jay, has signed an order forcing the people in Nebraska to potentially stay there for another 21 days just because, like, oh, hantavirus sounds so scary. And like I saw some tweets about it maybe being airborne. So let's keep them there. Let's just keep them locked up for no reason. These are Americans. Our government is locking people up because they have an infectious disease that they don't even have, that they could treat and they could monitor for, and they could still have no risk to the general population, to anybody else, if they were allowed to home quarantine. And they're not being allowed to do that. And people who are going into an Ebola outbreak that is set to be historically the worst Ebola outbreak we've ever seen are not going to be able to access this level of care. They are going to be forcibly imprisoned, again, by the US military, it sounds like, in a foreign country where they will receive substandard care to what they could receive in the US. Substandard care that, by the way, creates a huge containment risk, and especially a huge risk to those healthcare workers that are providing that care in an environment that doesn't provide the same kind of containment that a biocontainment unit would. So, this is pretty bad. And I am not a fan of this. Believe it or not, I get a bad rap because I'm so pro-vaccine and everybody thinks I'm into mandates and lockdowns and so forth. But the reality is I'm actually very pro-medical freedom. The reality is there are no such thing as vaccine mandates. In the US, everybody can choose whether or not they get a vaccine, and I don't support forcible vaccination. I support people being educated about what the evidence says about vaccines and making decisions based on that, because I'm a scientist and I've been trained to make all of my decisions based on what the evidence tells me, not on what I want or what will benefit me or what will advance my political agenda. And so, that is how I feel. I feel strongly about medical freedom. I feel that people should be able to, Americans should be able to exercise their constitutional rights and make their own decisions about their medical care and about being repatriated if they get fucking Ebola while they're off responding to an Ebola outbreak. I feel that, it is not justifiable scientifically to deny Americans their right to re-enter their own country when they need help the most. And I think everybody really, really needs to understand that the US government is announcing that if you are politically inconvenient, if you get a horrible, lethal disease like Ebola abroad, your government's going to lock you up and keep you from coming home and taking advantage of the facilities that your tax dollars paid for. That's to cover up the fact that this Ebola outbreak is so bad in the first place because of all the money that they took away from foreign aid, from those countries, from the investments that we had made in global health. So, policies that endanger people, Kenyan Ebola prison, stamping all over our constitutional rights. Like, this is very un-American. It's very undemocratic, and everybody should be protesting this. So once again, my risk assessment of whether you're going to get Ebola in America has not changed. And the travel ban, this forced quarantine, all of this stuff does not change my risk assessment. If people were coming back into the US, my risk assessment would be the same. That people are at low risk for getting Bundabugia virus. You're not going to get Ebola in the US, even if Ebola patients come back. But what is going to start happening is a bunch of Americans who've had their constitutional rights taken away from them and their government abandon them and imprison them, again, in a foreign country, leave them to die, and possibly use our military to force them to die in these conditions, is really unconscionable. They will do this to anybody for any reason. So people really need to see what the risk is here. The risk is not that you're going to get Ebola. The risk is that our government is incompetent and unable to respond to these outbreaks, and they're willing to trash your constitutional rights in order to cover that up and make it seem like they're actually doing a great job. So with that, I'm going to sign off. I'm just going to leave you here at the end of this episode with this wonderful video that shows what our Secretary of Health and Human Services and Administrator of the Center for Medicare and Medicaid Services have been doing to respond to the Ebola outbreak themselves. Now, while podcast Lockdown J has been busy signing, forcible quarantine orders, Bobby's been snake wrangling.
Well, they were having sex, so what were they?
Opposite.
They're not moccasins.
Oh, Cheryl, he gets you every time. But I just like wonder what is this weird asshole problem that he sees two snakes looking on his pool deck, and he decides that he's gonna like get bitten by them. And good for the snakes. Like I'd bite somebody too if they interrupt me in that situation. Especially at this guy's house. Ugh. You know, at least there's not a bunch of bird flu ostriches there like these two wanted to bring. The only thing that could make this better is if a bunch of bird flu ostriches like walked up in the background or something. Fortunately, though, they are no more. Anyhow, I'll see you tomorrow for another update. You know, chances are something horrible is going to happen between now and then. So I'm sure we'll have a lot to talk about. But in the meantime, have a great day, everybody, and don't get locked up in Kenyan Ebola prison.